Welcome to this afternoon's lecture series entitled Crisis in a Cocker Spaniel. Joining me today and heading up this lecture is Dr. KuKanich. She's with K-State in Manhattan, and we are very, very fortunate to have her with her experience. We're very, very happy to have you. I have started the recording, but I'm going to go ahead and make you the host, Kate, so you can go ahead and share screen and so forth. So I will do that really quickly.
Excellent. Thank you so much. Can everybody hear me okay? Wonderful. I'm going to go ahead and share screen and start my slideshow. All right. Martha, can you hear me okay?
I can. And now I'm going to mute my microphone so you can steal the show.
Perfect. All right. Well, I want to thank you guys for inviting me to come and speak this afternoon. As she described, I am on faculty at Kansas State University in the College of Veterinary Medicine. I'm an associate professor of internal medicine, but I also work quite a bit with the Masters of Public Health program. And I do quite a bit of other jobs here at the college. I work with our junior surgery program. I work with our outreach program, and I do quite a bit of teaching throughout the curriculum in all 4 years of our veterinary school. And so I always get very excited at the opportunity to be able to speak to a number of outside people and encouraging various different people to come and join us at the vet school. So hopefully you guys will enjoy this lecture today. So what is internal medicine? As I mentioned, I'm a board certified specialist in small animal internal medicine. Internal medicine is a specialty. So I went to 4 years of veterinary school. After that, I did a 1-year internship in small animal medicine and surgery and emergency. And then I did a residency in internal medicine. So that's 3 years of intensive learning on one specific topic. And you can do a residency on a number of different topics. I chose internal medicine, but other options would be things like surgery or ophthalmology or oncology or dermatology or anesthesia or radiology. There are lots of different things that you can choose to do a specialty in if you elect to do that. And probably about 10 to 20% of our D.V.M graduates will go on and do an internship, and then some of those will go on and do a specialty and become board certified. So what is internal medicine? Internal medicine is kind of the problem solvers of the veterinarians. So we deal with the cases that have the most challenging diagnoses, the ones that have concurrent diseases. So we manage cases that may have a dog or a cat that may have heart disease and kidney failure. They may have anemia, but they may also have diabetes. And so we're trying to balance multiple different things at the same time. And oftentimes our patients are critically ill. So they're hospitalized, they stay with us for a while. And many times they need fancy diagnostic tools and fancy treatment medications and things that may not be as available at every practice in the state of Kansas or across the country. And so we have tools available to us that not everybody else has the ability to have, just because of the cost and the training that goes along with becoming an expert at using those tools. So I'm going to go through a case with you guys today. This is a very typical case that might come in and see us as an internist. This is a dog named Otis. He's a 5-year-old male castrated Cocker Spaniel. He weighs 17 kilograms. If you're not comfortable with kilograms, if you multiply that by 2.2, that would give you about how many pounds he is. So he's going to be in the 35 to 40 pound category. And the reason that he knew he was sick is because he went to the groomer, as most Cocker Spaniels do. They go to the groomer quite often, and the groomer told the owners that he had some yellow skin and his eyes looked a little yellow. So it's not uncommon for groomers to pick up on something that maybe an owner or a family is not quite aware of because you see him every day. So more history, the owners also were commenting, and there was some discrepancy between the mom and the dad on this, but they also noticed that Otis had 2 episodes of collapse while he was at home before he came in to see us at the vet. And what they described was that he stumbles and falls a little bit while he's walking. The mom thought that he was actually having seizures. The dad thought he was just clumsy. And we get a lot of this arguing or bickering over what exactly is happening in the patient. And that's really common in veterinary medicine because our pets can't tell us what's wrong. And so it's very common for us to have a history of something that we may not actually know what's really happening. We don't know if this dog just tripped over his foot or if he had a full-blown seizure or if it was something completely different. And so we have to kind of go back to what exactly did you see? And for now, we're just going to label it as an episode of collapse. And we're going to use our mystery skills, our problem-solving skills to see if we can figure out exactly what caused that collapse. Even though we can't ask Otis, what are you feeling? Does your brain seem normal? Is the rest of your body normal? Were you feeling faint before that happened? Did you trip? Did you actually trip? We can't ask him any of those questions. So we have to use our problem-solving skills to sort that out.
You can just...
So we do a physical exam when he comes in to see us, and the physical exam is one of the most important things that we do as veterinarians. And what we notice is that instead of being a really happy-go-lucky dog, he's pretty darn quiet. He barely wants to lift his head up off the exam table. We also notice that he's icteric, and what I mean by icteric, another fancy word for icteric is jaundice. In the human healthcare world, they use the word jaundice more often. We tend to use the word icteric, but what that means, oops, sorry about that. What that means is that he has this kind of yellowish skin. Let me see if I can change my pointer to make it, there, that might be a little better. He has this yellowish skin. So if you look in a part of the dog where there's not so much hair, and usually that's on the belly or the inside of the ear, instead of the skin being kind of a pale pink color or a white color, his is actually very, very yellow, like a banana color. And then if you look at the whites of his eyes, where it should be white in his eye, it actually looks very yellow. And so that we call icteric or jaundice. And so that's a big concern if it happens in a dog or a cat or a person. That's always a concern if we see that on physical exam. We notice that his heart rate is maybe a little bit fast for a dog, 120 beats per minute. His temperature is okay, 102.4 is actually normal for a dog. His respiratory rate of 36 per minute is normal for a dog. And the rest of his exam is unremarkable. So then we want to start to think about what do we do next with a dog like this, who has a history of this yellow skin and these collapsing episodes. So as an internal medicine specialist, we are master problem solvers. And so we want to think about this in a very logical way. And so we're going to create a list of problems. We're going to brainstorm about what could be causing each problem. And then we're going to perform some tests, some diagnostic tests to rule in or to rule out those ideas. And we're going to try to narrow down our list to find our answer. So we're going to approach this very, very logically. And that's the way that an internal medicine doctor thinks about a case. So our problem list is that we have icterus, and again, that's the yellowing of the skin and the eyes, and we have collapse. So what causes icterus? The easy answer to that is that there's too much bilirubin. But many of you in the audience are going to say, but Dr. Kate, what does that mean? What is bilirubin? So bilirubin is the normal breakdown product of red blood cells. So if you think about when you get a bruise on your arm from trauma, if you fall in the park and you get a bruise on your arm, it starts off kind of a dark purple and then it turns to kind of a yellowish color, right? And that's because that blood is breaking down into bilirubin and that turns into that yellowish color. That's bilirubin, that breakdown product of red blood cells. So you can have too much bilirubin if you have too much destruction of red blood cells. You can also have too much bilirubin if your liver is not processing correctly. So bilirubin is processed in the liver. So if your liver isn't working well, you can have too much bilirubin. And then the liver is supposed to transport bilirubin from the liver down through the bile ducts to the intestine. So if there's an obstruction here, if there's an obstruction in the bile ducts, then bilirubin can't go from the liver through the bile ducts to the intestines, and you can end up having too much bilirubin. And all three of those steps, if there's a problem in any one of those three steps, you can end up with too much bilirubin in your bloodstream and then too much bilirubin causing icterus or jaundice of your skin and your eyes and your gums. So we need to figure out which one of these three steps is causing the problem in Otis. Where is his problem? So where's the problem in Otis? So we want to think of this, is it before the liver? Is it in the liver or is it after the liver? So if it's before the liver, then we want to think, is this a problem causing destruction of red blood cells? And the fancy word for destruction of red blood cells is called hemolysis. Heme meaning blood and lysis meaning destruction, hemolysis. If it's a problem in the liver, that's hepatic. Hepatic is the fancy word for liver. Typical problems in the liver that can do this would be something like inflammation, like hepatitis, an infection. We can have fungal infections or bacterial infections like leptospirosis. We can have toxins, where there are a number of different plants that can cause toxins in the liver. Or we can have cancer in the liver, and any one of those could cause enough liver damage that could cause an increase in bilirubin and then have a dog or a cat that has this jaundiced look to them. Or like we mentioned, we could have a post-hepatic problem. We could have an obstruction of our biliary tract. In a person, that would be most commonly caused by a stone, a gallstone. You guys have probably all heard of a person having a gallstone. We don't commonly see gallstones in dogs or cats, but we will see things like tumors on occasion in the biliary tree. Or the most common reason we would have for this category would actually be if the pancreas gets really inflamed and swollen and then pushes down on that biliary tree and causes obstruction that way. So our goal now is to figure out which of these three categories is causing it in Otis. So we want to do some diagnostic tests, and we want to target our diagnostic tests so that we can rule in or rule out these brainstorm ideas that we just had. So we have a list of brainstorm ideas. Now we have to target our diagnostic tests and spend our clients' money the most efficient way so we can come up with this answer. So the first thing we talked about was, is he having red blood cell destruction? Is he having hemolysis? And that's why he's having too much bilirubin. And if that's the case, he should have a lower red blood cell count than your average dog. So we can do a blood test and look at the amount of red blood cells in his bloodstream. That is a really cheap and really easy test to do. So that is the first thing we will do. If it's a liver problem, we would expect to see increases in some of the liver values in his blood work. We would also expect to see maybe some changes if we look at his liver. It might be bigger on radiographs, on x-rays, and it might have changes if we were to look at it with ultrasound. It might be darker than normal, or it might have masses or changes within the liver. So that can be helpful to rule in or rule out liver disease. And then if we're looking for evidence of obstruction, really the best way we do that in veterinary medicine is with an ultrasound of his abdomen. In human medicine, they would probably do a CT scan, and we could do that too, but it's a lot more costly, and we can usually get our answer with an ultrasound of his abdomen. Another fancy word for an ultrasound is a sonogram, if you're more familiar with that word. Okay, so I said the very first thing we would do is check to see if he has enough red blood cells. This is a very cheap test. We can usually do this for $10 or less. And so we're going to look to see what percent of his blood is made up of red blood cells. Normally it should be 40% or more. So this one on the left is a normal dog. And with Otis, we found he had 12%. And so he has way too few red blood cells. And so we know already that the answer for Otis is that he has too few red blood cells. Something is destroying his red blood cells, and that is why he is icteric. So we have already come to a major conclusion. We have already solved the first part of our problem. We know why he's icteric. We're not sure why they're being destroyed yet, but we know that this is prehepatic, this is hemolysis, this is destruction of his red blood cells, and he is very, very anemic, and anemic means that his red blood cells are too low. Okay, so we're going to move over to the collapse part, and then we're going to come back to bringing it together. So why did he collapse? When we think of a dog or a cat or a person who collapses, there are kind of three main categories for why anybody might collapse. It could be a problem up in the brain, and usually that's because of a seizure, but there are lots of other things that could cause it in the brain as well, like a stroke. So a problem up in the brain. It could be a problem in the heart, and usually in the heart, we're thinking about something like fainting. Syncope is a fancy word for fainting, and usually there's an arrhythmia that can cause someone to have a collapsing episode from heart disease. So an arrhythmia is when the heart is not beating regularly, and that can cause you to have a collapsing episode. So we want to think, is this a brain problem? Is this a heart problem? Or is this a lung problem? Is this a problem with either there's not enough oxygen getting down to the lungs? So if you can imagine, if you had, if you're babysitting and your little brother chokes on a piece of food and it gets stuck in the trachea, all of a sudden not enough oxygen is going to get to his lungs and the rest of his body, and he's going to collapse if you don't get that out of him. So that is a major reason for collapse. If he had major lung disease, so if these lungs were very diseased, if they were full of fluid or full of infection or full of cancer, that too could cause not enough oxygen, and they could have a collapsing episode from that. Another reason that we can have collapse related to the lungs is if we're not having enough red blood cells. So if we just don't have enough red blood cells to carry this oxygen to the rest of the body, that can be a major problem. So remember, red blood cells are going to take oxygen from the lungs and carry it to the heart, and then it's going to go to the brain and to all the other parts of the body. So that can be a major problem. And we've already identified that our patient does not have enough red blood cells. So why did he collapse? Because red blood cells carry oxygen from the lungs to the body, and the brain, the heart, and the muscles all need oxygen to work. And so if we don't have enough red blood cells to carry that oxygen, we're going to have weakness in our brain, our heart, and all of our muscles. And if we get low enough oxygen, low enough red blood cells, we are going to have collapsing episodes. So it makes very good sense that a dog with a low number of red blood cells would have collapsing episodes. So these are definitely related problems. So let's go back to why he's destroying his red blood cells. So we want to look at his actual red blood cells closely. And what we notice when we look at them closely is that they're actually clumping together. We can see here within the tube, and we can see when we make a slide, that these red blood cells are clumping together. And the reason they're clumping together is because his body has started making antibodies against the red blood cells themselves. So his own immune system is destroying his red blood cells. This is a major problem, a major flaw in his immune system. And to make it worse, once these red blood cells start clumping together, they can make a bigger and bigger and bigger clump. And eventually it's a big enough clump that we call it a clot. And that blood clot can then travel to places and get stuck and cause even more problems. So you may have heard of elderly people who have blood clot problems and are actually taking blood thinning medication to prevent complications from blood clots. So sometimes we'll have people who have blood clots that go to their lungs and can cause major problems, or have blood clots that go to their legs, the deep veins in their legs called deep vein thrombosis, and they can have problems there. So our dogs with this disease will have major complications secondary to these clots that they have. So other diagnostic tests that we can do, we pretty much already have our answer in this dog, but some of these other tests can give us a little bit more verification. So usually we will run a chemistry profile on this dog just to make sure that we know how high the bilirubin is. We already know, looking at this dog, because he's yellow, that the bilirubin is going to be high. A normal bilirubin for a dog is less than 0.2 milligrams per deciliter, and his is 8.2. So his is very high, which is not surprising. The rest of his liver values are unremarkable, which again is not surprising because we already decided his liver is going to be fine. This is a problem with his red cells, not a problem with his liver. When we check his urine, we notice that he's actually having this brownish red color urine. And that also makes sense because there's some of that destruction of the red blood cells that are getting into the urine as well. And we do an abdominal ultrasound on him, and his liver looks fine and all the rest of his organs look fine as well. So what causes hemolytic anemia? Remember, heme means blood, lytic means destruction. So hemolytic means destruction anemia. Hemolytic anemia is caused by antibodies that are produced against the red blood cells. And so sometimes we'll call this immune-mediated hemolytic anemia. And because that's such a mouthful, we usually abbreviate that to IMHA. And so a lot of our clients of our pet owners, of people like Otis, will know this disease as IMHA. This is a very common disease seen in Cocker Spaniels and Schnauzers and Poodles, especially our big standard Poodles, which is a dog that I happen to own. And I say common, it is a breed-specific disease that is in their family lines. We see it more often in those specific breeds, but we can see it in any breed of dog. And we can see it in cats as well, but it is more common in those particular breeds. Now, in those breeds, we see it with no underlying cause. So a Cocker Spaniel may get this disease just because their immune system decides to go haywire, and this will happen. Same with Schnauzers and Poodles. In some of our other breeds, that can happen, but we can also see this disease caused by or triggered by certain cancers or certain infections. And so if we have an older dog with this disease, with hemolytic anemia, we will look to make sure that there isn't a cancer that has triggered this. Because if there is a cancer triggering it, if we can take care of that cancer, if we can fix it, if we can surgically remove it, a lot of times that will help us dramatically to treat the IMHA that the dog is having. Same with infections. So if this is a younger dog who has not been having proper preventative medications, tick-borne diseases can trigger this anemia. Ehrlichia disease can do this, Rocky Mountain spotted fever can do this, anaplasmosis and Lyme disease can all do this. And so we want to make sure that our pets are well protected from tick-borne diseases. They get a monthly tick preventative, and we look and remove ticks from them as quickly as possible. And so if we have a young dog that presents with immune-mediated hemolytic anemia, we might consider testing them for those specific infections as well. Again, if they do have that infection and we treat that infection, we have a much easier time of controlling the immune-mediated hemolytic anemia too. Okay, so we want to update our problem list. We have a lot more information than we did at the beginning of this talk. So our old problem list was icterus and collapse. Our new problem list is we have a very well-defined disease now. We have hemolytic anemia, or other people will call it IMHA. And we want to characterize that. So we can characterize that as severe. And the reason I call it severe is because we talked about that percentage of red blood cells in him. We call that the PCV. And his is 12, where normally it should be greater than 40%. It's also severe because his bilirubin is 8.2, where normal is less than 0.2. And he's having collapsing episodes, and that's a big deal. Collapsing episodes are a big deal in a dog, just like they would be in a person. We have not found any underlying cancer or underlying infection in Otis, and we suspect that his is because of his breed. He's a Cocker Spaniel. He is essentially the poster child for this disease. And because his disease is severe, we need to start treatment on him fast. And treatment on him is going to be really important. He is a patient that would go straight into our intensive care unit here at Kansas State University. And I anticipate he would stay with us for 4 to 7 days or so. So treatment, acute crisis treatment. He's having a PCV of 12%. That's again the amount of red blood cells he has. He's having collapsing episodes. He needs more red blood cells. That's what he needs more than anything else, is more red blood cells so that he can carry oxygen around and oxygenate the rest of his body. So we can give him more red blood cells, and that's what he needs right away. And then long-term, what he needs is for us to treat an underlying cause if we found one. Again, we didn't find one in him. And then to use medication to alter his immune system so it stops destroying his red blood cells. And that gets a little bit tricky, but we have some tricks up our sleeve to help with that. So he needs a blood transfusion, and he needs one pretty quickly. And as you guys probably know, anytime anybody needs a blood transfusion, they need it pretty quickly, right? So in human medicine and in canine medicine and in feline medicine, we need to be able to have blood products available to us pretty quickly. And so we do have a canine blood donation program at Kansas State University, and we're always looking for universal donors, and we screen for infectious diseases. So I'm going to talk a little bit more about this later on, but blood transfusion is a critical part of treatment for a dog like Otis. And many dogs with this particular condition will get multiple blood transfusions during their treatment. And it is a life-saving treatment for him. The transfusion itself is usually administered over 3 to 4 hours while they sit in ICU in our intensive care unit, and we monitor them very closely while they receive that blood transfusion. We're also going to give oral medications to slow down the destruction of the red blood cells. And so the most common medications that we use are prednisone, and some dogs will respond to prednisone alone. Other dogs will need more medications in addition to prednisone. So cyclosporin is one that we oftentimes will use as well. Cyclosporin helps especially when we see a lot of that extra clumping of the red blood cells together. But we have a lot of other medications, other immunosuppressive medications that we sometimes need to use with these patients. And each patient is a little bit different as far as which drugs they respond best to. And all of these medications have different side effect profiles. And so we need to tailor them very specifically to the patient in front of us. There is no cookbook way to treat a patient like this. And so that's why having expertise and specialty training can be really, really helpful. And then we're also going to provide other supportive care. So one of the most important things that we do is try to minimize that clot formation and the complications from that clot formation. So just like in humans who are worried about having a deep vein thrombosis or a pulmonary thromboembolism, a clot up in their lungs, we're going to give them medications that can help to minimize clot formation. And there are a number of different medications that are used, and we use the same types of medications that people use. You'll notice, if you're familiar with human healthcare, that we do use a lot of medications that are approved for use in human healthcare. We do have a couple. This one right here has pictures of dogs on it. We have a couple that are specifically approved for dogs, but most of the medications like the prednisone here are approved for use in humans, and we're using the actual human products on our canine, on our dogs and on our cats. And so we get to know these medications well. We have a variety of studies that help us to know how our patients are going to respond to them. And it is an art to know how to treat these cases the best. Okay, so the outcome for Otis, again, he started before his transfusion was 12, after the transfusion was 23. And you may be wondering, why didn't I give him more blood to get him all the way up to 40, which would be a more normal PCV for him? And part of the reason for that is having enough blood and him being able to tolerate that much blood in a short period of time can be tricky. Another part of the reason for that is we want to give him enough blood to get him to where he's a whole lot more stable, but still encourage his bone marrow to kick in so that he starts making those red blood cells back on his own. If we give him back all of the blood that he needs, we're not sure how fast his bone marrow is going to start making those red blood cells, and we don't want him to become dependent on any transfusion, at least right away. So this is a typical response after a transfusion for them to come up into the mid to upper 20s, but to become much more stable. So his heart rate is much better, respiratory rate, his energy is much better. This is not actually a picture of Otis, but it's very common after a blood transfusion for a dog to start off being very lethargic, not wanting to lift his head off the table, and by the end of the transfusion to be wagging his tail and ready to go for a walk outside, feeling a whole lot better because of those red blood cells that we've given them, because those red blood cells are carrying oxygen to the rest of the body and just giving them an overall increased amount of energy. So Otis stayed with us in the hospital for another 2 days for monitoring, which is a relatively short amount of time for a dog with this condition. Many of these dogs will stay for more like 4 to 7 days, and it is not uncommon for these dogs to need multiple transfusions, but he did especially well. He was treated with prednisone orally. Over the next couple of days, his PCV rose to 28%, and he was eating and feeling much better. So prognosis and outcome for Otis, he's going to be coming back in for rechecks very frequently. Usually we would see him back every couple of days initially, and then as that 28 goes up to 30 and 32 and 35, then we start spreading out those visits to weekly and then to monthly. And so we'll start seeing him a little bit less frequently over time. Many of these dogs do very well, and after they are well up into the 40 range for that PCV, for that percentage of red blood cells that they have, then we will very, very slowly wean them off of their medications over 3 to 6 months. So it's common for these patients to be on these medications orally for quite a long time, 6 months, 8 months, 9 months, 10 months, 12 months even. That's common, but they do tend to do very well. So Otis did great and made a full recovery. So in summary, if you like to solve complex problems, if you like to perform and integrate many different diagnostic tests, if you'd like to help really sick dogs and cats to feel a whole lot better again, then you would make a great internal medicine veterinarian. So we would love to have you come join us at Kansas State. And then I also wanted to put in a plug for blood donors. So I know some of you are in Olathe, but if any of you are local here in Manhattan, Kansas, K-State is always looking for canine blood donors. So if you have a dog who might be able to donate blood, we are always looking for blood donors that could help save a life like Otis. And I'm sure you were aware, but the American Red Cross is always looking for humans that are willing to help save a life of a human with blood donation as well. So I always put in a plug for that as well. But I have information here if you're interested in contacting the Kansas State Veterinary Health Center about screening your own personal pet to see if they may be a good blood donor. They typically come in every 2 months to donate blood. And the way it works is our blood donor staff would actually call you and set up a time that's convenient for you and ask you if you could bring your dog in. And they are really flexible about working around your schedule to make it a good time that would work for you. And there are some nice benefits that your dog would get for becoming a blood donor, lots of preventative care and free veterinary health care and food and that sort of thing. So if this is something that could be right for you and your dog, please go ahead and consider that. All right, thank you so much. And I would love to take any questions that you might have about Otis, about hemolytic anemia, or about veterinary medicine in general.
I have a question.
Sure.
So when you were running the chemistry profile, you did the blood test to determine the bilirubin number. Could you have done that with a urinalysis and gotten the same number, or is it more accurate to do it through the blood test?
Yeah, so that's a great question. So can you get a bilirubin off of the urinalysis? So the urinalysis will tell you if there is bilirubin in the urine, but that's a different number. That's a different value that you're looking for than looking at the amount of bilirubin in the blood. So yes, it is helpful to know if there's bilirubin in the urine, but that's not a number that we're going to monitor over time. We actually do monitor the bilirubin in the blood over time, because that's going to tell us, as that starts coming down, that's going to tell me that there are fewer red blood cells that are being attacked. And so if it started at 8.2 and I check it again next week and it's 4.2, I'm going to be really happy. The urine measure of bilirubin is not nearly as sensitive. And so it's going to be more of a 1+ or a 2+. And so that's not going to be nearly as helpful for me to follow over time. So I would do a chemistry in a dog like this, a blood chemistry, so I could have that more sensitive value. Good question though. And just for the record, dogs are allowed to have some bilirubin in their urine. So just seeing a little bit of bilirubin in the urine of a dog does not actually mean anything is abnormal at all. Any other questions?
I have a question. What initially got you interested in internal medicine?
That's actually a really funny question. So when I was a undergraduate student and the majority of my time in veterinary school, I was 100% convinced I was going to be a zoo vet. And I had worked at, I think I have worked at 15 different zoos now. I've worked with a lot of different zoo veterinarians. And my husband and I always joke that when we're watching the TV shows that show the zoo veterinarians, almost every TV show we'll see either he's worked with the zoo veterinarian or I've worked with the zoo veterinarian, and we recognize all of them because we've just had a lot of experiences between the two of us. And he's a pharmacologist, which means he studies drugs. He's a veterinarian on faculty here as well, and I'm an internist. So neither one of us have any direct zoo work anymore, but I've done quite a lot of zoo work. So I was convinced I was going to be a zoo veterinarian. And then when I got to my 4th year in veterinary school, during the 4th year in veterinary school, we do rotations where we'll do 3 weeks in internal medicine, and then 3 weeks in soft tissue surgery, and then 3 weeks in orthopedics, and we rotate through all the different specialties. And I had already planned that I was going to do a month at the Indianapolis Zoo and a month at the Phoenix Zoo. And I had a couple other zoo activities planned into that schedule. But I got to my internal medicine rotation And after the first 2 weeks, the resident pulled me aside and said, "Hey, Kate, I'm so glad to hear that you're going to become an internist." And I said, "I don't know where you heard that from, but I'm not going to become an internist. I am going to be a zoo vet. I have my life all planned out." And she said, "Well, that's funny. You're going to be an internist. Like, I can tell. We're changing your plans." And I just kind of laughed and blew it off initially. But she was persistent, and she kept kind of nudging me towards, "Your brain works like an internist. You are a very good internist," even though I was a fourth-year student, and fourth-year students are still learning a lot, and they have so much to learn. But she kept saying, this is a good career choice for you. You should really think about it. And so she planted that seed, and I started thinking about it. And over the next year and a half, I really started thinking about zoo medicine and internal medicine and the differences between them. And I'm not sure how much she realizes it, but she changed my entire life. And so I still love zoo medicine, and fortunately working at Kansas State, we have an excellent zoo medicine program, and I still get to collaborate with them a lot. And there is a lot of internal medicine in zoo medicine. So I still get to do endoscopy using the endoscope and looking down into the stomach of a snake and pulling out a foreign body from a ferret and really cool things like that. But I also get to use my super logical problem solving brain to do internal medicine in dogs and cats. And so super long answer for your question, but there are a lot of great specialties in veterinary medicine. And honestly, I think a lot of us would be happy in a lot of different specialties. And so I encourage you, if you are going to become a veterinarian, to explore all the different options and figure out which one is really best for you. And then once you get into a career, don't be afraid to say, "You know what? I've been doing this job for 5 or 10 years, and I'm getting a little tired of this particular part of veterinary medicine. I'm going to take a left turn, and I'm going to go over and do this type of veterinary medicine now." Because a lot of people, I don't look that old, hopefully, but I've been out of practice, or I've been out of school for about 20 years now. A lot of people my age have had a few left turns that weren't predicted by the time they get to my age. And it can be a really good thing too. So I encourage you to keep your mind open as you're looking at different options, even within the veterinary profession.
I have a question.
Sure.
How did it feel for you once you helped your first animal?
How did it feel for me once I helped my first animal? See, now that's a tricky question because I don't even know who the first animal was. I can tell you that the first day that I was an actual veterinarian, which is long after I helped probably my first animal, but the first day that I was an actual veterinarian, I was during my internship at Tufts University. And if any of you are familiar with their hospital, they have one of the most amazing intensive care units and emergency programs in the country and probably in the world. And so I walked into their intensive care unit, and it was eye-opening. And I was on this emergency shift. And my first 8-hour shift, we had 5 CPRs that happened, and CPR stands for cardiopulmonary resuscitation. And that means when an animal actually passes away, so an animal is trying to die. And when that happens, there's usually like a siren that goes off. It sounds like a tornado alarm. And you hear the tornado alarm, and all the doctors run to ICU to help this patient who needs everyone's help, right? So that happened 5 times in my first 8-hour shift. And 3 out of 5 of those, they actually opened the dog's chest and did hand compression massages on the heart of the patient. And to me, I was thinking, oh my goodness, I just graduated from vet school like a week ago. This is my new job. I have that much responsibility now. What in the world did I get myself into? So there are going to be moments of panic throughout your career if you become a veterinarian. And the important thing to learn is that we've all been through those, and we all come out the other side, and we all help so many patients, so many dogs and cats along the way. And beyond the dogs and cats, we help so many owners, so many families, so many moms and dads and kids who love those animals along the way. So my first day as a veterinarian, I was like back up against the wall, eyes wide open like a scared deer. And a year later, when I finished that internship, I was like an expert. And of course, I was an expert like I've been out for a year, not like the faculty who have been out for 15 years or 20 years. But I was so much better. I was so much more confident. I had done so many of these things, and I was so much, I had so much more experience. And it takes a really good mentor to get to that point. But at that point, I was 100% confident walking into that room, helping those patients and feeling so proud. And so there's a big learning curve, and that learning curve happens over and over again, whether you're in high school and you're starting off at your very first vet clinic, whether you're in vet school and you're learning how to draw blood or put a catheter in, whether you're in your very first job and you're doing your first surgery by yourself, that learning curve goes on and on and on. And so what I encourage everybody that I mentor is to find yourself a good mentor. Make sure that you always have somebody that you can call when you need to call them, and to give yourself a break and to realize that we are all learning. We're all doing this for the right reasons. And there are so many people and so many pets out there that are going to benefit from the goodwill of you going into this profession. And so take care of yourself along the way, and remember all the patients that you have helped and all the patients that you are going to help along the way. Again, another super long-winded answer, but I don't know which patient I helped first. Probably my stuffed animal that I bandaged a million times when I was a kid.
I hope we have some more questions, but in the meantime, I wanted to make sure people realize that there was the chat box, and I've put there the URL where you can find other vet medicine lectures that have taken place. They're archived there, and Dr. KuKanich will also be archived there. So you can see this lecture at a more leisurely pace. Go back and view it again and again and learn more stuff from it. But I wanted to make that available to you as a resource. And now I'll turn it back over to you and see if there are other questions that have been generated.
Actually, I have another question, not necessarily related to this. So I'm a junior at K-State, and I apply to vet school next summer. What would you recommend for like me to like get my foot in the door, like at the vet school? Like I've worked in an animal clinic for the past 2.5 years, so I kind of have that aspect.
Yeah, so that's awesome. We're excited for you to apply and to come and join us. There are lots of opportunities. So certainly you can reach out, and if you have time, you can try to reach out to a faculty and see if there is opportunity to do research with somebody here. Some of our faculty take on research assistants during the year, so that's a possibility. You can come over to our open house and meet faculty and meet students that way. You can, during the open house, there's always a discussion about the application process, so that can be helpful as well. During the interview process, which I'm sure you will get to that stage, we do tours, and we have sessions where the students will meet with you and give you lots of more information then as well. At K-State, at least most of the years, there is a session where we actually do practice interviews as well. So I'm not sure if you're familiar with that, but that usually happens around November, and it's over, I don't know it's the building that has the old football stadium in it. I think it's the student preparation, graduation preparation, something like that. But that's another great program that we do, where a number of us faculty actually go and do mock interviews with students who are going to apply to veterinary school. So if you haven't seen that yet, that would be a great thing to consider as well.
Great suggestions, Dr. KuKanich. Is there a time of year when that open house may occur that they could kind of look for on the website?
Yeah, the open house is always right the first or second week in April, and it's Kansas state wide. So hopefully we'll be able to have it this year. It was obviously canceled in 2020, but it's across campus. And at the vet school, we have tons of really cool activities. So it's a great way to be able to meet various faculty, to be able to see live animals, to be able to tour the facility. Lots of really neat things at the vet school open house.
Do you do any sort of research things? Because when if I get into vet school, I'm looking into like emergency vet.
Mm-hmm. Yep, I do quite a bit of research, and I am in charge of the summer research program, which is called the Veterinary Research Scholars Program, or the VRSP. And that's a program where over the summer, between your first and second year and between your second and third year, we pair you up with a faculty researcher for 12 weeks, and you do a project with that researcher in the lab for that summertime. And then we also have other activities, journal clubs and workshops and tours, so that we can teach you other things about research, like research ethics and research writing, and we introduce you to lots of different types of researchers. So that's a program that's really great, and you would learn quite a bit more about that in the first year of veterinary school if you're interested, and I could help you apply for that program too. For emergency medicine specifically, we do have several faculty who are specific emergency medicine faculty. I don't know if those in particular are doing any research at this point, but we have lots of faculty in the small animal hospital that do research.
Any suggestions, Dr. KuKanich, about their prep, their high school or college experience if they want to pursue this field?
Yeah, the most important thing is just getting a lot of hands-on veterinary experience. So work with as many different veterinarians as you can. Try to don't just be a fly on the wall, but actually get your hands dirty, and try to work in a small animal practice and work in a large animal practice, and if you're able to volunteer. When I was in college, I volunteered with the laboratory animal veterinarians on campus. And I volunteered at a horse place in town. And I obviously I worked at a lot of different zoos. And so the more different types of veterinarians you work with, the more you'll be comfortable handling those animals when you get to veterinary school. It'll increase your chances of getting into veterinary school, but it'll also give you great ideas as far as what types of veterinary practice do you like? What types of things don't you like? Which animals are you more comfortable with? Which animals do you need more practice with? All of that comes with experience. And so the more experience you can get before you come here, the better. And we teach you the basics. We teach you how to draw blood and that sort of thing. But the more hands-on experience you can get, and even just the more interaction you can get with clients and just hearing cases like what I just went through, if it's more familiar to you when you get here, it'll stick easier. It'll be easier to learn and easier for you to understand.
I don't see any other questions in the chat box. Anybody else have other questions they'd like to ask?
Well, thank you guys all so much for attending. I hope you guys are having a safe semester and staying safe and doing well in school. And I hope you guys all end up applying to K-State Vet School. I would love to see you guys here.
Thank you for joining us and giving us great information, Dr. KuKanich. And you may be hearing from a couple of these folks who have been participating today. Thank you again for spending your time.
Excellent. Have a good one. Take care.